Shir- Okay, thank you so much for Miss Shirin for handling our topic today. So, Assalamualaikum and good evening, everyone. Okay, my name is Dr. Norfida Ismail. I am Medical Science Officer in NIO International Seram Berhad. So, our topic today is about stroke. So, do you know that actually 17.9 million of people die each year, every year due to stroke? So it is as no as to say this number is outstanding because it's die every year 17.9 million. So this is statistic according to WHO, World Health Organization, on 2020. So it's record worldwide. So when you heard this number, how to say is very worried for need you to know, because our population is not, we can like simply vanish because of the stroke. Okay, so I'm moving for the next slide. Will be, this is one of the article I take in Malaysia by Dato Dr. Nur Hisham bin Abdullah. So our General Health Ministry of Health Malaysia clearly state that, you can see the box, green box I highlight there. Stroke is the ranking number third of leading causes of death in Malaysia, death or mortality in Malaysia. He also predict that if let's say we, how to say, we not taking care of ourselves, or we not know how to prevent ourselves, maybe in 2040 the stroke will be ranking number two. So this is clearly said that stroke disease we cannot simply ignore or not to take care each other. So before I move further to topic stroke itself, I will explain first what is the stroke actually, how to prevent, and what are the risk factor or what the complication of stroke. All right. So what is stroke? So basically, stroke is occur when part of our brain lose the blood supply or stop working. That means rupture in the blood vessel, or a rupture of the blood vessel, or disruption in the blood vessel. So as you can see there, the causes of stroke divide by two. So causes of stroke, the first one, an abrupt blockage of arteries that leading to brain. We call as ischemic stroke. As you can see the picture on your left side, the brain part, the left side. Okay, you can see the blockage of blood vessel. That's why we call as ischemic stroke. So the second causes of stroke is a bleeding in the brain tissue when blood vessel is burst or ruptured. As you can see the picture on your left side is the blood vessel rupture. So these two main causes of stroke. So when this is happen, that's why you can see you cannot move. Suddenly you cannot speak. Suddenly you can your movement is, how to say, immovable. So this is causes of stroke. Okay. So type of stroke. Type of stroke have a three type of stroke. The first one, ischemic stroke. Second, hemorrhagic stroke, and the next one, transient ischemic attack. So basically, ischemic stroke, as I mentioned the previous slide before, is just abruption of blockage. So as you can see the picture I highlight there, is the blockage of the blood vessel. Okay, for the next one, hemorrhagic stroke. So this is the bleeding in the brain tissue. That means the rupture of blood vessel or burst the blood vessel. And the last one will be transient ischemic attack. So this is we call as a mild stroke or mini stroke. This is we can say the blood flow is in the brain blocked temporarily. So this means sometimes you can feel your hand numbness or your legs or any part of your day numbness. Maybe it's a, we can say, the mild symptom of stroke. So you should take care of yourself and be alert of your body itself. Okay, so now we know the type of stroke and what are the causes. So now we're moving for risk factor. So I know some of you or some of your family members of the person, how to say, okay, I simply have a high cholesterol, I believe, okay lah, just eat medication, then you should be fine. No, some of the symptoms that can risk the factor that lead to stroke. This is 5 general risk factor. So as you can see there, I mentioned 5 risk factor. The first one, high cholesterol, high blood pressure. So these two risk factor is very popular, very common among the patient who are having stroke. When there's too much of blood pressure and too much of cholesterol, that's why they need to eat medication, and some of them feel numbness on the hand, on the legs. So these two risk factors are very common among stroke. And the next one, too much of stress. Of course, stress hormone, the cortisol hormone. So that means you stress from the work, stress with family members, all that. So can lead to stroke also. And the next one, heart rhythm disturbance. So that means the irregular heartbeat. And the last one, diabetes. Okay, so these five risk factor is the major that can lead to stroke. So you need to take care of yourself or concern for your family members. If let's say they have this kind of risk factor, please check. Okay. And the next one, after we know the risk factor, so we should know the symptom of stroke. Simple. We just remember fast. FAST, fast. So the F is the face. If let's say you can see your face sometimes like, not sometimes, if let's say one day your face is like drooling like one side or two sides, so that means that one is a symptom, mild symptom of stroke. Okay. A is the arm. So if let's say your arms cannot move or you cannot bring up or down, so that means something's wrong. All three numbers, that's why it's a symptom of stroke also. So the next one, S, is a speech. So that's means your speech is mumbling, you cannot speak well, or you mumbling like that. So that one is considered a symptom of strokes. And the last one, time, T. So it's matter of time. The speech difficulty. So it's matter of the time. Let's say you didn't check, so you just wait for you to fall down because of the stroke. So this symptom of stroke, you need to remember, just remember fast. This is very important. All right. Okay. So after we know about the symptom, so we should know the complication of stroke. So based on my experience in the hospital, so most of the patients who are having stroke is not die because of stroke. They die because of the complications. So as you can see there, the first complication is their behavior. Their behavior change. So some of the patients will be facing depression, anxiety. So you need to they need to at least they're not depressed or anxiety because they're having this stroke. And second, the speech difficulty. So after they're having this stroke, reading. Okay, so they cannot reading properly, most of the patients. And the third one, the numbness. So the numbness or the pain that you can feel usually on your hand and your leg. Sometimes you feel like you cannot move suddenly, or the numbness like tingliness. So that's the numbness. And the last one that we need to really to avoid is paralysis. So paralysis, the face drop and cannot move arm at all. Usually it will happen one side. So make sure if let's say this kind of symptom or complication of stroke, please check with your doctor in the hospital or clinics. So please check. Okay, so this is the complication of stroke. So after we know all that, we should know what are the treatment is available out there in hospital. So here I simply generally I will split by two: hemorrhagic stroke, which is the burst of blood vessel; ischemic stroke, the blockage. So usually we taking care for the hemorrhagic stroke by remove the blood. So we call by surgery. So simply remove the blood and relieve the pressure, and we tie again the blood vessel. So that's how we do in surgery. If let's say for ischemic stroke, we divide by two. At least maybe you just prescribe, the doctor prescribe you by medication to break up the clot, or endovascular procedure. This one is to be treated directly by endoscopy or that inside your blockage blood vessel. These are the type of treatment that are available in the hospital. So now, okay, so I know some of you is like, okay, I don't want the hospital or modern medical science or only modern medical treatments. So some of you will find another way, which is we call alternative way, natural treatments. Yes, we do have some of the natural treatment we call as reducing electron therapy. So this is what we do. Okay, reducing electron therapy is a biochemical reaction that we provide the negative ion inside our body. So we simply give negative ion towards your body. So the main effect, okay, so this is what are the benefit of reducing electron therapy. So I want to focus mainly on the last one, to improve your blood circulation. So again, improve blood circulation because stroke is, remember the causes of stroke, the rupture of blood vessels and the blockage of blood flow. So by this treatments or this therapy, it can improve your blood circulations. Okay, so now I will explain how this negative ion treatment can help most of the stroke patients. So the first one, decrease in serum MDA LDL level. So MDA is a malondialdehyde modified LDL. So this is we call as oxidative stress marker. Remember the previous slide, I tell you the risk factor that could lead to stroke. Is one of them is the stress. So oxidative stress marker, this is the one, MDA LDL. So before I explain how negative ion affect our body, so I will explain first how this serum affect our health. So the first one is, you can see on your left side, high LDL cholesterol. So that means if let's say you're having a high cholesterol in your body, it will perform fatty acid degeneration. So fatty acid, as you can see the first picture last time, sorry, this one also can use. You can see on the right side, the blockage, the yellow part is the fatty acid degeneration. So the fatty acid. So when this is performed, we call the oxidative form as a MDA-LDL level. So MDA-LDL is after they perform like very big, as you can see the picture on your right side, we call as atherosclerosis. So atherosclerosis is basically a medical term. That means the blockage of blood vessel. So when this is happen, your blood cannot flow smoothly. So that's why you're having a stroke. Okay, so this is how negative ion treatment, reducing electron therapy treatment help. So when reducing electron therapy having in your blood, having travel in your body, it will attack the aggregate blood in the serum MDA LDL. So when the blood is start to disperse and the serum MDL will be decreased, so that it will increase the blood flow in blood vessels. So that means your blood flow will be smoothly. So this is how reducing electron therapy counterback the MDA LDL level. So this is the second one, how they will help in terms of the promote the formation of new cells. So this one is because of the usually for the ischemic stroke. So as you can see, when your brain blood supply is not forming too well, so your blood vessel cannot move. So this is how reducing electron therapy can help. It will repair and perform the new cells. So when this is happened, it will blood will flow smoothly. And you can see the first effect is the improvement of one side paralysis. So that means usually stroke patient will be having problem with left side. So it will improve one by one, maybe hand first and after that slowly begin of the leg. So improve one side paralysis. So when this is happen, because the inside your body, the new cell is performed. So this is happening. So this is how reducing electron therapy help the stroke patient. So this is one of the clinical trial that we use. This is MRI scan of cerebral infarction for female aged 53 years old. So as you can see, original on the left side is abnormal. You can see the circle, I circle there, the black color. The blood vessel is like twisting. So this is the blood supply is not run smoothly. And after 8 months of the treatment, you can see the blood vessel on the right side will become separately from each other, so that the blood supply will run smoothly. And this is a MRI scan for cerebral infection. So you can see the red dot, the red circle I circled there. You can see the hollow, the black color is before reducing electron treatment. So that means there is no cells in it. So after 2 months and after 4 months, it slowly begin to form a new cell. So this is how reducing electron treatment can help most of our stroke patients. So as the conclusion, okay, reducing electron treatment is can eliminate radioactive oxygen, active your brain cells, and repair your damaged cells, and plus improve your blood circulation. This is very important. Okay, and furthermore, this treatment have no side effect and promote natural healing, and we treat the root, not the symptom. So again, the choice is on you. So whether you want to choose a modern way or alternative way, which is less pain. Okay. So our product is 100% imported from Japan. And if let's say you have any questions or any you want to know more about negative ion, you can ask us on email or hotline number. And also we open for Q&A session. So any questions right now? So far, any questions? If let's say you have a question, you can ask me. Hopefully, I will answer one by one your questions.
My name is Kenneth. How do you determine how the person should be treated? How long, or how do you determine that? Help advise the patient first before they come in for treatment?
Okay, thank you, Mr. Kenneth. Okay, so I will answer. Okay, basically, our stroke patient will come with the blood report and also the MRI scan and MRA scan. So we do the treatment based on the blood report and the X-ray result. Then also MRI scan. So if let's say you are okay, usually the fastest recovery is 8 months. That is our record, 8 months. So if let's say you are mild stroke, maybe you can heal in within 1 month. So it doesn't mean you focus only on our therapy. Maybe not, maybe it's confirmed you need to taking care of your foods. So it doesn't matter, you need to focus 100% on reducing electrotherapy. We need to combine with your food intake, your diet, your exercise, all that, your movement. So hopefully I can answer your question. Is it okay, Mr. Kenneth?
That's okay, but how let's say example, if you quote a case like that, let's say for example, we may need a treatment period up to full recovery of 8 months. How do you determine how often do we need to get this treatment on a daily basis or weekly, twice a week or something?
Okay, so this is I'm studying based on my experience. So last time we do have one uncle who having a mild stroke. So for us, for him, we do twicely a week. So it will come like twicely a week based on the performance. If let's say you are how to say the very bedridden patient who are having stroke, you need to do every day. So every day we can do like 8 time of treatment or 12 time of treatment. So it depends on your body itself. So if let's say you're having a stroke patient, you can come to meet me and we discuss regarding the treatments, how much you will do, how much of the time of treatments, how many minutes you need to do. So this is how we our process.
Okay, that is very good. That's very good. Thank you for sharing. But maybe what you can do in your presentation also, just a suggestion, Saja, yeah? You can actually give maybe some scenarios, maybe 2 or 3 scenarios of a mild, a more medium type of treatment and a more serious one, because then I think the public or the people that want to know, because most people won't ask you a question, okay? They would like to know, number one, does the treatment have to be done at your center? Is that the only way, or is there an option to do at my home, or do I have to find another alternative solution? Yeah.
Oh, okay, understand. Okay, thank you, Mr. Kine, for your feedback, all that. Thank you so much.
So, Kenneth, may I speak, talk something? Kenneth, how are you?
I am good, Lilian. Of course, I know you, but I purposely asked the question is so that if the people that come in to listen to the talk, they will get a better idea. While the basic information shared is very important and very good, I think sometimes you need to give a picture to people. Yeah.
Yes, yes. Actually, I want to share one case. This case is happening this year or so. One of my staff mother got a stroke, so stay in hospital. One of the hospital, 9 days already developed the bed sore. Okay, yeah. I think Dr. Fida also seen this patient, and because the mother cannot move, so that's why she also did not admitted to my center.
Right.
So she ran the machine back to use, and we at that time is she cannot move lah. Okay, and you look at the patient, you know that really suffer. Then we recommended her how to do. You know, one day minimum 8 times, but if she want to recover fast, she can do more. Okay, so by one, you know how she do, then she, because of this lady about 70 or 70 years old and got a lot of children. So the children, they almost do 24 hours. They take what is that called? They take turns, you know, they take turns to do. So means that after they do 20 minutes, they rest 1 hour.
Okay.
Then 20 minutes. Yeah, almost more than 8 times that we advise, but it's no harm. Then amazing things happen. This is what my staff report to me. The mother, after 3 weeks of our treatment,
right,
this mother sit up to watch TV.
Okay, all right.
Very good. And after 8 weeks, not 6 weeks, 1.5 months, this mother can slowly walk already.
Okay.
And very good.
Yeah.
But you see this, why this thing can recover so fast? Number one, 24 hours. I think more than 8 times. Okay.
Right.
And of course, with the children's love and care.
Right.
Yeah. And also because of this patient, after got this stroke, 9 days, then she managed to use our machine. That's why recovering very fast. Why like that? There's something to do with the nerve system. You know, maybe the things that it's not the massive no, maybe it's a small nerve or what. But when we first time see Fida, can you describe that the first time how we look at this lady, Dr. Fida?
You mean the stroke patient, is it?
Yeah, the jinjang there.
The jinjang. Okay. So basically, at first, it's a bedridden patient. She cannot, how to say, she cannot fill up the field at all. She cannot move at all. So I just take the blood, and the blood is quite difficult to come out from the fingers. So it shows that the blood flow is not run smoothly, and the blood is very sticky. So after, I believe after 1 or 2 months, if I'm not mistaken, according to their daughter, she said the mother is like can move a bit. The hand can move a bit, not like this. It's like slowly move, and also she can move a bit the body. So this is how we can.
It's not what move a bit. No, the 3 months, 3 weeks. The mother sit up to watch TV. This is called too amazing. You know, there is the friend always come. The one, what is the name? Mr. Woon.
Mr. Woon.
Then she said that he told us that very amazing. Then why like that? You know, there's something to do with our water, the water in our brain. Maybe Kenneth, you listen to what we want to present. Then come to the end, I will talk more about this.
Yes, because yes, I'm sorry. I'm just not trying to interrupt your session. I'm trying to ask stimulating question because I noticed as one of the attendees, Mr. Hibula Kong, I think he also asked a question for healthy people. Inje Aiman also asked another question. So I think the questions are coming in. It's good for us to understand it a bit better.
Yeah. Then we because now I invite another science officer, Sharing, to talk whatever she wants to talk about. Fida, thank you, Dr. Fida. Thank you very much for your sharing. So we will
thank you.
Yeah. Okay, you will know more about our product through the sharing, and I will quote a few examples that I see with my own eyes how this thing help. Okay, next. Thank you, Fida. Okay, Sharing, please.
You answer the questions later on, is it?
Yeah.
Okay. So my side, I would like to share to you all a bit more information on what actually reducing electron is. So first, I'll be talking about this self-defense diagnosis. Well, so what actually is the self-defense diagnosis? The self-defense means that the ability of your body to be able to fight diseases for you. So when you say that someone has a very strong self-defense, it means that their body is strong enough to help them to fight diseases or infections. So self-defense diagnosis actually consists of these following three elements. You can refer to the picture below here. There's a triangle. So every corner of the triangle actually represents a very special traits. So first you can see the first trait is the level of cellular metabolism. And cellular metabolism is actually very important to our human body to be able to maintain a healthy body. Because metabolism, in a way that how it defines as metabolism is that our cell will absorb the nutrients and convert these nutrients into energy, which our body required this energy to carry out our daily lives routine. Okay, so if our cells cannot carry out this metabolism, what will happen? So these nutrients, it will be absorbed into our cells, but our cells do not have the ability to burn or to convert these nutrients into energy. So these nutrients will slowly accumulate inside our cells, and like after some period of time, these nutrients will actually be oxidized and turned into toxic substances. So when our cell consists of toxic substances inside, you can imagine that our cell will actually be weakened and then slowly it will die. So in a sense that if we did not promote our cellular metabolism, our cells will have toxic substances in them, and so they will not be healthy. They will just weaken and die. And this will affect our self-defense as well. The second point is the strength of immunity, which is the degree of immune balance. As we know, our immune cells and our immune system is like a soldier of our body. So whatever infections, whatever diseases that attack our body, they will be the first line defense to help us to fight. So if we do not have a very strong immunity, it means that our immune cells does not have the ability to help us to fight diseases or infections. That's why some people, when their immunity is low, they can get sick easily. The third one is the level of inflammation sedation. So for inflammation, it actually can be triggered by a lot of factors, like our environmental pollution, or like our digital devices. Like a lot of people depend on them nowadays, your computer, your iPad, your phone, anything that can expose you to radiation, or even like you're overstressed, you overwork, these factors will actually trigger inflammation. So if this inflammation keep increasing in your body, like your body has a high level of inflammation, it will actually put you into a higher risk of having a disease. So that's why it's very important to keep your inflammation level at the lowest as possible, and help, if can, just reduce your inflammation in your body. So once you fulfill these three traits, like three of them is at a very optimal level, you can say that you have a very strong self-defense, which means that your body are strong enough to help you to fight against any infections or diseases, which is then will allow you to have a healthy body and you will not get sick easily. But once something is wrong within these three elements, like one of them, you are not at the optimal level, your self-defense may be affected. And so your body might be affected as well. You might get sick easily. So it's very important to actually ensure your self-defense is at the optimal level to make sure that your body is always strong enough to help you to fight back the infections, the diseases, and to give you a healthy body. Okay. So the next thing, you can see that 70% of our body is made up of water. And this water is actually very important to us. Why I say that? It's because this water is like the home for our cells. Our cells live in this 70% of water. So like human, they also require a very good environment to live in. Like if you want to be happy, you want to be healthy, you will for sure hope that your environment, your house is very comfortable, very clean, very neat, and is in a environment that you are comfortable with. Okay, so for ourselves, they actually require the same thing, which is why 70% of our water should always be the environment that they required, which is weak alkaline. So once this 70% of water becomes acidic due to the accumulation of positive ions, these cells will actually will not be able to survive in this condition. So they will become weak and they will slowly die. And our body at that time will not have enough of healthy cells to help us to fight against any diseases or infections. So what does it mean when our body fluid is dirty? It means that our body has been turned into acidic. So like I said just now, when our body fluid has been turned into acidic, our cells actually cannot survive in it. So what we have to do is we have to convert this acidic body fluid back to weak alkaline, which is suitable for our cells to survive in. And in this case, our cells will be healthy. They will produce more healthy cells. And also our immune cells will be strong and ready and active to help us to fight our infections and diseases. Okay. And this is the principle that I mentioned just now on how to convert our 70% of acidic fluid to weak alkaline is by inducing this reducing electron into our body. So as you can see at the left side here, hydrogen ion, which consists of a positive charge, is actually will cause our body fluid to be acidified. And when our body fluid is in acidic condition, we will actually get disease, which is why we will get sick easily. However, if we induce sufficient amount of reducing electron in our body, when our body has this reducing electron in it, this reducing electron can actually help us to neutralize this positive charge of the hydrogen ion. So when it neutralizes this positive charge, it will produce a neutral atom, which is a hydrogen atom. And when we have enough of hydrogen atom in our body fluid will be in weak alkaline condition. So if you remember, I've mentioned that when our body fluid is in weak alkaline, our cells will be able to survive, which will help us to bring back our health. So this is like the principle of how reducing electron can actually help us to maintain our body fluid in weak alkaline condition for our cells to survive and for us to have a healthy body. So besides of having sufficient amount of reducing electron, we actually need to look at other factors that are required for us to build our health. And here you can see there are 6 rules to help us to build our health, which is suggested by the reducing electron inventor, Dr. Noboru Horiguchi. So the first rule is by having sufficient amount of reducing electron. So our ET machine will help us to restore and build health by inducing the reducing electron that our body required daily, so that this reducing electron can help us to repair our cells, to cleanse our body fluid, to make them convert back into weak alkaline for our cells to survive. But besides that, we need to ensure that we have moderate exercise. As you can see on the second point, moderate exercise means you can carry out exercise that your body can stand. So for example, you prefer light exercise, so you can go walking for 30 minutes per day, or if you are capable, you can go for slow jog or any other exercise that you prefer and you feel that your body can take it, and then you can do. As long as you move your body and to make your cells active, then it's good enough. The third rule is to have a balanced diet. Balanced diet means that you need to have a balance of nutrients, which you can refer to your food pyramid. So we know the food pyramid, the lowest level is carbohydrate, and then we need to intake fruits and vegetables, and then the least that we need to consume is the fats. So you can refer to this food pyramid and adjust your diet accordingly, which diet that suits for you, then you can follow. And also very important, you have to make sure you drink sufficient amount of water. Here, we put 3 liters of water, but the amount of water actually depends on your body weight. So you need to find out how much of water that you need to take daily, and then you just follow the amount that you are required. Okay, so make sure you have a balance of nutrient and also enough water every day. So number 4, we need to make sure that we have 7 hours of sound sleep. 7 hours of sound sleep means 7 hours of deep sleep in a day. Deep sleep means that you did not dream about anything, because dreaming is like a light sleep, which means that your mind is still you are still conscious. So deep sleep means that your mind already shut off, and then your body, that time, your body will start to repair everything. So for example, for the whole day, you work, you carry out some daily activities. So at this time, when you're having a deep sleep, the cell will actually repair themselves. So for the next day, you will feel like, oh, you are refreshed. You are ready to start a new day again. So that's why it's very important to have 7 hours of deep sleep to let your cells to be able to repair themselves for the next day. Okay. And number 5 is about your medication. So you should actually continue medication prescribed by a doctor until allowed to stop. So at the same time, when you're taking your medication, you can actually use the reducing electron machine to induce reducing electron. Because we know that when you get sick, you go and see doctor. They give you medication. For example, you fever, you have flu, you cough, they will give you medication. So the medication is actually to help you with your symptoms. And reducing electron, the difference between these and the medication that the doctor gives you is that we actually help you to find back your health through the fundamental, which is your cells. So when you are taking your medication, it helps you in the symptoms. When you are using the reducing electron treatment, it helps you to repair your cells. So when you combine these two together, it will actually give you a better effect. So for medicine-wise, you need to continue your medication until your doctor say, okay, you're fine. You can stop the medication, you don't need them anymore, then you can stop. But for the meantime, if you are still taking any medication, you need to follow your doctor's order. Okay. For the last rule, which is a lot of people ignore this very important rule, is a positive mind. So a lot of us that we know we need to take nutritional food, we need to have exercise, drink a lot of water, sleep well. But a lot of us actually ignore the importance of having a positive mind, because your mind actually is connected to your body. So whatever you put into your mind will actually send the signals to your body. So if let's say today you are not in a good mood, you have negative mind, so you keep thinking, okay, I cannot do this, I cannot do that, my body is weak, I don't have strength, I cannot be healthy anymore. So your mind will actually receive this signal that you put in and then transfer them to all over your body, into your organs, into your system. So once your organs receive all this signal, they will be like, oh, okay, so this person don't want to be healthy anymore, so I will stop working as well. So they will start to have a lot of problems. That's why you might get sick, you feel uncomfortable. But once you encourage yourself or put positive thinking in yourself, like you tell yourself, okay, I'm healthy, I want a healthy body, I can do this. So all these positive signals are actually transferred to your organs, your system. So they will receive all these signals and they'll be like, okay, I need to work harder, I need to give health to this person. So you'll actually be strong and healthy, and you are able to fight diseases and infections as well. So it's very important to have a positive mind and also positive surrounding, which means that you expose yourself to positive people with positive mindset, like your friends, your family. They are very encouraging. They support you in any ways. Then it's very great for your health as well. So once you practice these 6 rules, you can actually build your health back. So for the next one, this one is about the basic elements of human body. As you can see here, what we know, our body need water, oxygen, nutrients, protein, carbohydrate, vitamin, fat, and others. But what we actually overlook is reducing electron. And human body needs 13 billion of negative ion, or in this case is reducing electron, per day to be healthy. And this actually is a research done by the WHO, which you can see there's a note below there. And they actually found out that our human body needs 30 million of reducing electron per day to be healthy. Because our body is actually born with this reducing electron. But because nowadays we are exposed to a lot of things like pollution, the digital devices that I mentioned, your computer, your phone, and also stress. So all of these things actually will use up the reducing electron that is originally inside our body. So when you use up something, you need to top up. Just like your fridge in the house, once you finish the food, you will go to the grocery store, you'll buy, and you will refill your fridge, right? So same for this reducing electron. Once you use up, you need to give it back to your body. If you do not top up or give reducing electron to your body, once this reducing electron is depleted, there will be nothing in your body to help you to eliminate all those positive ions. And once the positive ions start to accumulate in your body, remember what I said just now, your 70% of fluid will become acidic. And this is where sickness comes from. So it's very important to ensure that you give or you replenish your body with the sufficient amount of reducing electron required per day to make sure that your body always have enough reducing electron to help you to eliminate all the toxic substances, to make sure that your 70% of the fluid is always in a weak alkaline state for your cells to survive, so that your cells will be healthy. They are able to help you to fight any diseases or infections. This is the very important element of our body, which we always overlook at. Okay. So reducing electron is a treatment and also a prevention. We know that there's a saying that say prevention is always better than cure. So preventing diseases is the assure of a healthy body. Once you can prevent sickness from your body, you can stay healthy. Okay. So at the bottom, you can see Dr. Nobuo Horiguchi actually said that by inducing this nature's energy, reducing electron into our human body, this will enhance our body's recovery and self-healing power. Then fight diseases without any side effects and treat diseases fundamentally. So like I've mentioned just now, this reducing electron, we have it in our body, is like a nature-given reducing electron. So this reducing electron treatment is something we provide, something that is required, that is originally in your body already. We are not putting additional things like medication or any other substances in your body. It's what your body needs. That's why we call this nature's energy. And what we do is we provide this energy to your cells to make your cells healthy, so that they have the ability to help you to fight diseases, which is why we say this will enhance your self-healing power. Self-healing power means that you do not depend on anything to help your body to heal. You are using your own body, your own power to help your body to recover and heal itself, which is your cells. Once your cells are healthy, they have the ability to help you to recover and heal yourself, which is why we say this is a self-healing power. Okay, and fundamentally means that the fundamental of our body is our cells. That's why we say reducing electron treat diseases fundamentally, because we start from your cells, which is your fundamental. So this is what I've mentioned. We are the root treatment. We are not treating symptoms like the Western medicine. So you can see the picture here. Our body is kind of resemble a tree. A tree, if you want a tree to be healthy and strong, you need to make sure it gets sufficient amount of nutrients and also water. So these nutrients and water actually go to the tree by its roots. So the roots is the fundamental of a tree. Once a tree have strong roots, it will be healthy. Just like our body, our fundamental is our cells. So our cells will serve as our root. Once we have active and healthy cells, we will have a healthy body. If you see the right picture, is like a wilted tree because it does not have a healthy root. Just like our body, if we do not have healthy cells, or our cells are weak, we will be easily get sick. So the process of root treatment actually consists of 4 steps. The first one is to stop. Stop means we stop your condition to get worse. Any disease, any discomfort that you have, we will try to stop it to get worse. The second step is cleaning. So once we stop your condition to become worse, we will start to clean. Cleaning means that we will convert the 70% of acidic body fluid back to weak alkaline, which is suitable for your cells to survive. So this is like the cleaning process. Once your body fluid is clean, we'll move on to the third step, which is repair. So at this stage, your cells the damaged cells, anything that need to be repaired, it will start to be repaired as well. Okay, the last step will be rebuild. Rebuild means that you rebuild your whole body, you rebuild your health. So the process of root treatment actually consists these 4 steps. First, we stop the condition from becoming worse. Second, we clean your 70% of acidic body fluid. Third, your cells and other organs will start to repair itself. And 4, you'll rebuild your whole body and rebuild your health. Aside from all these reducing electron that you are required to keep your body healthy, like I mentioned just now, mindset is an important thing as well. So healthy body begins from healthy thought. We know that when we are awake, any decisions that we make is actually come from our conscious mind. So what we don't know is actually our subconscious. We need to communicate with this subconscious mind. Why? Because this subconscious mind is the one that helps us to recover ourselves and to maintain a healthy body. Just like I mentioned, our mind and body is connected. Once you put any negative or bad thoughts into your subconscious mind, it will send the signals to all over your body, to your organs, to your system. So once they receive this signal, they will know that, okay, you don't want a healthy body. You feel like you cannot get your health back. So they will stop working as well. But once you communicate with your subconscious mind, you tell it that I want to be healthy. I can have a healthy body. So all this thinking will become a signal. It will be passed on to your organs, your system as well. And then when they receive, they will know what you actually want. So you want a healthy body. They will work hard to help you to maintain a healthy body. So it's very important to ensure that you always tell yourself that you want a healthy body, to let your subconscious mind to pass on these signals to your body to make sure that it has the ability to help you to maintain a healthy body. So this picture is actually a founder and inventor of this reducing electron treatment, which is Dr. Nobuo Horiguchi. So just like us, he also experienced loss of his mother and sister due to diseases. So at that time, he actually realized the limitations and the weakness in medical field. So he wanted to find something that can reduce the pain and reduce the suffer, the diseases that all of us have to experience. So after years and years of research, he actually found this reducing electron, and he started to introduce this reducing electron. So as for now, Japan has their own hospital, which is this Horiguchi Hospital. They are using this reducing electron treatment to treat all kinds of patients that they have there. And this hospital now is handled by his son, which is Dr. Hiroshi Horiguchi. And Dr. Hiroshi Horiguchi actually trained doctors on how to use this reducing electron treatment to treat patients. So he is always giving training to the doctors. And also Japan, they are still doing research on this reducing electron to keep finding a best way to help us to reduce pain, reduce suffer, and to treat diseases, which is why they always come out with new method, better method for us to help all kind of people. And also this is a revolutionary invention which has earned awards, and we have these 8 major awards. So a very important one is this award that you can see here. So it's include a lot of countries which the medical professionals they said that this reducing electron treatment actually is beneficial, and it does really help a lot of people. Okay. So we also is a certified medical device. This one is from the Japan's Ministry of Health, and we also have our own in Malaysia's Medical Device Authority. So we are actually a certified medical device which we can use to treat patients. So as for our product, we have 2 products now. The first one is Me Energy, which is the big machine, and the other one is IGE1J, which is the blower. These 2 machines actually has the same functions, which is to produce reducing electron. But the difference between these 2 machines, the big one actually it uses these plates, which you can see here. So we actually put these plates onto parts of our body, and these reducing electron will generated from this plate and pass through our skin into our blood vessels, and then they will be carried by our blood to all of our body. So the principle of this machine is by using this plate to put on our body. As for the blower, is through inhalation. So when it produces reducing electron, when we inhale, the reducing electron will go through our nose and go through our respiratory system and until our lungs. So this blower actually is very good for our lungs to help us to detox, to clean out, and also to help our lungs. So what we do is we actually uses 2 machines at the same time. So the big machine will put the plate onto your body to let your blood carry this reducing electron to all parts of your body. And at the same time, we'll use the blower when we are doing the treatment. So this blower will help you to strengthen your lungs. So you'll get a better effect for your body to regain health. So this one, you can actually get a free trial if you're registered with us. So if you're interested to understand the level of acidity in your blood, you can always make reservations through the number provided down below. Just WhatsApp us and tell us that, okay, you want to make appointment for free trial. Because like I mentioned, sickness comes from acidity. Everything is because of your cells are unhealthy. And why your cells are unhealthy is because their house is not clean. The 70% of your body fluid is acidic. That's why they cannot be in a healthy state. And when your cells are unhealthy, you won't be healthy also. That's why you are easily to get sick. which is why we say that sickness comes from acidity. So it's very important to understand the level of acidity in your blood. So if you are curious, you want to know more about this reducing electron, you can always WhatsApp us to make appointments or to ask us any question that you have in your mind. So apart from that, we actually do need your help because this reducing electron treatment exists in the market for only 25 years. So this medical technology actually is still not included in the education of medical students. However, from our experience, we can see the effectiveness and potential results from our patients. As Me Energy is a registered medical device, like I mentioned just now, we are actually restricted by MDA to perform any direct advertisements. So what we can do is we only rely on satisfied users like you to help us to share about this beneficial treatment. So if you think that this treatment will help anyone around you, like your friends, your family, your relative, any person that you care for, you think that this treatment will help them, feel free to share with them about this treatment. So this online sharing session that we set up every Thursday and Saturday is actually like a platform for you to invite your friends and family to let them know that aside from the Western and traditional medicine, there is always an alternative way to gain back health. So like I've said, if you feel that this can help a lot of people around you, feel free to share to them, invite them to this online sharing session every week to let them know more about what actually is reducing electron and how does it help us to gain back health. That's it for my sharing. Do you have anyone has any question so far?
Okay. If no question, I will share my experience towards this my own testimonial. My father passed away when he was 27 years old, and he got stroke. So I think burst of people say the big rain or whatever, immediately died. That time I was 3 months plus, just born. Okay. Before died, a stroke. Many years later, that who got stroke really suffer. So happened that my father and 1 is 2, 4, 6 like that. So then my mother before dying stroke about 8 to 10 years, then only died. Very difficult. She cannot walk, bedridden. We got made to the is until we send her to Penang. We send her to that is not a hospital. I think it's recovering place. Yeah, also stay there for a few years, then only die. So we know that a prevent than cure. And I also in my 11 years, because reducing electron technology in Malaysia already 11 years. Due to medical item, we cannot do the direct advertisement. We can treat cancer, we can treat Parkinson, we can treat this and that. We can do that because every year government will send people our advertisement, everything. They share with you in these 11 years. Okay, because myself, like what I told you, my parents got stroke before they died because of stroke. So I'm so scared of stroke, and I found out 19 years old, I already got high blood pressure. Very scary, because they say that stroke really is for high blood pressure. Don't stop high. Then I reached this. I got chance to use this machine is when I have I read my age is about cost me 7,500 a month. Okay, I consumed that for more than 10 years. I spent a lot of money in my medication. Okay, but my blood pressure remained unchanged until how I start to use this machine is because of one of the natural healing practitioner in Australia. He recommended me to use this. After use for 3 years, my blood pressure is standard until now. Okay, I already using for about 14 to 15 years already. Then, and I also noticed in my this 15 years, okay, then I can say that this machine, we got 3 ways. Like just now, one of you asking how to use on it. It really can help. So I draw my own conclusion in these 15 years. I treat this machine, you know, 3 ways of using. One is treatment. Treatment, I need to use it many times a day. The because last my mother is admitted hospital and serious accident, then I need to in hospital. Then I feel that I got a what is that off and on fever. Then my stroke, my of COVID-19, because doctor already warned me don't come every day. Okay, then I still go because it's very dangerous at that time. Then I need to visit him. Go because 2 years ago, when they started the COVID, because increase the immune system. To increase the immunity system, use the only one side, the left side. Because my so it helped me. About 4 days later, I gained back my health. Okay, I'm very happy. Then I experience my own self, and also I said that information take out a lump. Of course, there's now not cancer, but it's a lump, and got infection. So my left breast is very. I use the pad, the big pad I put on the pain part, and the small one I put in the ketiak, the things to just fall on it. Okay, then because it's so pain, I need to make it pain. When I wake up in the morning, so the pain part, everything become very soft and recover only one time. Why? Because I already use it for so many years, so I can stand the healing crisis. What we not allow you to use when start using this machine, we start with 10 minutes. That's because of when this thing go into your body, it will repair your body. It will discharge your inflammation. So while doing in the much crisis too much that you feel so irritating. Doctor saw me not in Malaysia. So in that time, we don't have WhatsApp. So also, I go through all this. I am using my own body to stand. The doctor, the bone doctor, to do the urut, all these are very painful. So now no need. You just do the big plate, small plate, you put together. You put the big plate on the swollen, the most important part there, very pain, then you put on it. Okay, the small one is the other side, then you tie it. Then if you tie it, this is the things they give to us. Because it's ankle, very difficult to tie. The ankle, then I tie it. Okay. And just now, target treatment. Now, usually, I am maintaining my health. Every day, I got reducing electron go inside. About 60 years ago, WHO World have a healthy body. You need to have a 60. No, 13 billion. And our machine moment will go 5 million to eliminate your because after using and you go and check your blood, then your white blood very about 11 years, and I'm using no, I'm seeing whatever cancer patient when they are very hardworking to do the left side, to computer. We can see that how active is in their immunity. Yeah, okay. And another thing is just now I think the two speakers did not touch on the okay. According to research, we got about 70 to 75% of water. So our brain cell here, whole kepala, about 60 to 75%. Stroke patient, usually we can see the first thing is their water is very your level of acidity. The level of your blood will clamp together, cannot move at all. Okay, and this is what I have when I first time see my blood. Yeah, if I got in my my friend, you see, those days when I'm so excited, you know, when I know that, but all my friends who come for checking their level of acidity. Then I got one. I said, oh my God, you need to come for treatment. He said, no, I don't have any sickness. Nothing. He said, nothing. He said, no. I say, you are something not so good. Can see from your blood. So, you know, he said, no. So he did not come for treatment. 10 months later, when he eating with people in one restaurant, then he fell down. From then, he never wake up, never talk a words. And he, until he died, massive stroke. Okay, so that's why I said prevention is better than cure. But because it's our social friend, I did not know that he is so rich. He stay in a very rich place. Okay, he stay in a very rich place, and he's very rich. But I'm very sayang, only start just I think retire and start to enjoy life, you know. And because of he did not know, he did not prevent the because stroke patient for my so many years, I saw stroke patient very difficult to recover. That's why I always tell people, when you got friends got stroke, quickly invite them to understand this. You see, that's why recently I can say that my friends, my ex-staff mother is very lucky. My friends, my ex-staff very lucky, because let's say the mom cannot walk, cannot wake up. Okay, is there suffer, children suffer? Okay, after using a 4 months, so he returned back the machine. He said, mother already well already. So she did not talk about the prevention, because it's from cannot move until now can move, can work back, you know. So thought that is a recover, but to us is we want prevention. That's why most of my friends, they buy because of the prevention. Those who know me, you all know that when I talk, I cannot, no sound come out from my mouth because my lung very weak. So today, with my age, I still can deliver a few hours talk, you know, because my work still do training, okay? So I can deliver few hours talk. Compared with those days, I was so weak. That's why people that surrounding me cannot know me. A lot of people know me, I cannot. So a lot of people, my old friends, they own the machine is because of they see my changes. Okay, so just now I'll talk about the brain. The whole brain got 70 to 75% the fluid, the water. So all your nerve cell, if let's say your nerve cell is surrounding by the house, like I like the way Sharon said, the house for the cells is dirty, acidic, acidic water. So your nerve, your vein, all rendam, soak in the acidic water. If one of your, if you did not go and purify it, one of your nerve already got stuck or oxidize, okay, other place slowly also will have the same thing. Then afterwards, I will teach you all what to do and how to do it, okay? That's why we need to do a prevention. I think I choose to die on my own bed rather than ICU bed. That's why I very rajin to do this, yeah, for prevention. Those that they think that there are no sickness, because another case I want to tell you is one of my friends, he already got the symptoms of stroke. So the son sent him from Sungai Buloh to Pantai Hospital. So after that, she described to doctor, said that all this, you know. So doctor put him for the MRI scan, and the MRI come out, said that nothing wrong, it's perfectly all right. So did not admitted, go back home. On the way back home, he got stroke, and numb already, cannot already. So, but he came to us, it's too late, no? 6 months later. 6 months later is too late. Then just now I said that 3 weeks, this stroke patient can sit up to watch TV. This patient, 9 days only. Because if let's say a stroke patient, the cause of the stroke is because of your brain, the house of the brain, the 70% of the water already dirty, acidic, no good for brain cell to stay, to live on. If let's say one cell already got affected, the other will kena also. That's why fundamental, we need to treat fundamental. That's why I also see whatever people that got not only stroke, Parkinson, Alzheimer, that one is that called Alzheimer, okay, forgetting things one. It's because of the brain cells, okay, already oxidized, got a lot of active oxygen, so make it spoil. That's why I got my own colleagues, because I in one international company for 41 years. So one of my old friend, the mother already start to cannot remember things, cannot sleep at night, right? Okay. Then he know that I'm in this. He asked me how to help. So now the mother, because it's just mother started to use. She sleep all night. So now she recovered totally, but you need some new, that one called what? Supplement. Then I also asked the mother to eat some supplement. What we are doing just now, you know already, we are cleaning your detox, detox your acidity, no good for your cells to live on. Yeah, then we got the 4 steps to review, but you need some supplement, especially the people that get old. They don't have, the absorption is very slow, and actually our reducing electron very good for your what is that called, your absorption, your absorb nutrition, absorb whatever. So this topic we already touched on 3 months ago topic. If you all want to know this topic, we will, of course, we will do it again. Okay. And the Parkinson, also the brain problem, okay. So acidity, this is a fundamental. Is the environment no good, the fundamental for brain cell to live. Water, 70% of the water. One of my brother's girlfriend, this girlfriend is about 49 years old. Okay, so she admitted hospital in this one of the hospital, already cannot recognize people because she got this Parkinson problem many years. and she went to whole Malaysia hospital and went to overseas hospital also to treat that, cannot treat. But came to last few months, she very serious, cannot recognize people, admitted to hospital, and stay there, also do not know how to treat. And came to know me, got this, came to admitted to us. I tell you, amazing happened again. Okay. And a lady came to visited her father's memory, and she and the brother told me this experience when they visited her in hospital. That's why I know this. But in these 4 days, yeah, I give intensive, very intensive treatment on the 8th. That's why it's for this lady. And the nose got the blood come out. But I said that no need to scare, because things in the brain cell damage need to come out. It can become the inflammation, you know, and got a blood clot there and cannot come out. Come out is very good. So 4 days, come out the blood. But once come out, become dry blood, no? You know, come out. She can feel something is the dry one. Then this is the very good testimonial experience for me to know that my machine do the wonders for Parkinson, for Alzheimer, for stroke patient, and very good. Especially medical not cure one, my machine can help. Actually, my machine is doing the fundamental. Is doing the fundamental. This is overlooked in the new medical science. And this happened for how our inventor are using the own body to test on how useful is the, you know. So he go and firstly before launch to the market, so he spoiled the leg daging, the cells died, spoiled. Then went to the modern medical 6 months. After 6 months, can see the bone already. The doctor say I cannot treat already, but amputate your leg. So our inventor cut my legs. Okay, no need to amputate my leg. Then over years old already, he still got a leg. Okay, so now you see he used own body, okay, to really tested this machine really can make a replacement of cell. So he is brave enough. Then he told the doctor, this is in one of the the research, only in the whole world, it's only Dr. Noboru Horiguchi research on the body, the fruit. Okay, so he got the PhD. So I study one of the PhD, and my ex-partner is a doctor. So I thanks my ex-partner because she told me that this is a blind, our machine can, it is good to help the modern medical science, whoever consume of the medicine, no matter herbs or others medicine, Western medicine, it will help the medicine to absorb well to the body. So she asked me to do this business, but I say I'm not in this profession. So I just want to invest. But because due to her, she migrated to on the whole family to others country already. So that's why I need to restudy back. Today, I need to thank her because she left. I restudy back the Dr. Noboru Horiguchi, some of the thesis that I gained my knowledge and confidence in that. That's why when you know that the science behind how this treat human body, because I employed biology science officer. So this lady told me that actually when they study the biology in body, the lecturer said reducing electron is very important for not human health, for all the living health. Okay, not only human, our kucing, our anjing, is very important. So I hope that the testimonial can really help you all. So the question just now, I think some of you asking question. Huh? So what I try to pass my message is, because of we to stay to prevent the stroke happen. Okay, so the more all the instrument X-ray, all this is take up is okay. I will touch more in this future. I have put my time research on the thesis of Dr. Noboru Horiguchi. That when I talk on cancer, I also will use my understanding and the research on Dr. Noboru Horiguchi, and through my experience, I will let you all open your. Okay, so I really thanks that I got chance to do this thing, more merit for in this life. That's why we say that we need your help. It's only through those who like us, who knows our sincerity, who knows our product. Okay, to recommend people to listen to Thursday and what's that called? Thursday and Saturday sharing. You all need to invite your friends. Actually, you will do a favor for your friend. Yeah? Okay. So I now is 9:30 already. I want to now, if you got time, I will share something how to use this machine about 10 minutes like that. Okay, if okay, Sharon, please help me. How to prevent? Okay, I will not read. Okay, this one is people that who got one machine. If let's say you got one machine, okay, this is accompanied by poor circulation of the head and neck. People that got stroke, Parkinson, or whatever disease inside the brain, like what I say, I see Alzheimer or Azima, I already cannot pronounce the name. So you use this one. You can see the A, white color. You put the big one on your head. The left one, you put left, and you use that to tight on it, okay? And you see the left leg there. You can see left leg there. Can see? Then there is a left. Sorry, there is a right side. Sorry, there's a right side. Okay, right leg. And you see that this one, when you do the blood circulation, please, user, You already have the machine one. You please look at it. You see, this small y is near the finger there. Okay. Then the right side, you are using the palm. You are not, the small plate is on the palm. The big plate is on the here, the opposite your palm. Okay. So you use it. Treatment time, 20 minutes per session. Okay. Treatment frequency is 2 times a day, and treatment interval is 60 minutes. So after 20 minutes, rest for 60 minutes. Okay, do it 2 times. The second one, next. Okay, so now you see, you come to the next. You can see the one Y and A. Okay, you put it exactly, just follow. Yeah, your right side. Then the left side using the same thing, because the left side is near your heart. So you see, 2 treatment also, you use the left side, that's for your heart. Okay. Also, this time you see 20 to 30 minutes per session. Okay, I suggest for those you always get a stiff neck, please do at least 2 times a day. You can do more times because this treatment is no side effect. Okay, the treatment interval also 60 minutes next. Okay, this is treatment 3. So you can see now the white color. Actually, this is below the, what is that called? Pusat called what? Never. Okay, I'm Malay educated for your information. It's put below the navel. Okay, all the simple terms sometimes I cannot pronounce. Navel. Okay, the A there. So actually, people that who rented our machine usually we don't teach them to use this point one, because it's nearly our private part. You know, is below your navel about 2 cm, 2 fingers like that. Okay, and for those who are short, near already. Okay, and you can see the another Y is the right side, and another Y is the right leg. Now you see now, you can see the fingers there. You can see the fingers. Now you can see the thumb, all this. Okay. Yes. Dimension also, you can use this one. Dimension. Yeah, you can use also. Okay. Because all the head problem is begin from that. So in order for you to prevent all these things use, you see, I do this, because I want my memory back. Memory, you want to gain back your memory, all this also, you do this. I am not young already. I'm already 60 over, okay? So I also know that one day I will lose all this one. So why loss? And we know why, isn't it? The first thing is because of 70% of your water is dirty. Okay, dementia, all this, stroke, okay, all the brain problem use this. Yeah, if you got one machine, you use this. Okay, and use 2 times. Okay, that another one you need to use your normal one. The next treatment 4. Okay, this is the normal way that we teach you all. We teach you all. Go back to what? Go back the 3. Go back treatment 3. Okay, you see the Y on the your kaki, your leg there. This one touch the, what point is that? Yongqian, I do not know what Yongqian in Mandarin, in English. The center, the leg center there. Quite center there, you see, you can see the thumb. Okay. So just now one is not, that one is for blood circulation, is not. Okay, come to fourth again. Okay, the fourth is a normal way. Normal way. So you need to do 2 times a day. This one you can do 20 to 40 minutes. And it's really help. Everything also, please, you want to practice a point, okay? 4 months. I noticed that if you, after you use the same point 4 months, it really helps one. No? You can see the result tremendously because cells, they will use about 120 days to work. Okay, so okay, another one, next. Okay, next. This one, like what Sharon just now said, that in hospital in this Japan, they're already using 2 machines. 2 machines because they found that all the things, all the sickness started from the autonomic nerve system. Okay, Chinese is called 自主神经. So now they use a 2 machine. They treat cancer patients. They treat people that who go to the office, go to hospital. They use 2 machines. So same in our center. So now people that who came to us also, we use this to treat our cancer patient or our patient that who needs, because all the sickness researched by Dr. Noboru Horiguchi is start from the autonomic nerve system. So this is something that when the autonomic system is okay, your hormone system, everything, your system is okay. Okay, so I hope that, but now I feel that I'm very grateful that some of the customer, they bought second machine. Why? You know, they use for 5-6 years, they buy second machine because they found that it's very good, and they also can use this one, and their family member also can use. If let's say you use this one, you no need to use like what just now, put here and there. You just put like that. One day, about, you know, maintenance, about 3 times, 4 times enough. That treatment is about 5 times, 5-6 times. So, and very easy. Then we got one cloth for you to wear on it. Okay. Then all these things, you no need to tie. You just put inside. Then you sleep on it. Okay. And the center there, you can see we use the our towel, a small towel, a face towel, put on it like that. Yeah. Okay. Because the blue color you can see. Okay. Next, still got something. No more. No more. Okay. Now you can 2 ways we can ask question. Ask me question, because the more you ask, okay, the more you learn. Hey, I am 15 years using this machine. There's last month, 2 months ago, when Dr. Hiroshi do the sharing, I still learn something from Dr. Hiroshi. Okay, so that's why I encourage you all. The more you learn and listen, the more you learn. Okay, the more confidence you have, and you can invite more friends to understand. When we are given a chance, we would like to help people. Okay, so if let's say you without knowledge, I don't think that you got confidence. Especially, you know, one of our user bought 2 machine one. He told me that he shared with the friends. What is that lah? I go to your website also, I cannot see that can treat cancer lah. Okay, cannot treat also the what's that this and that lah, you know, stroke lah. Then you ask me to do, and no advertisement. And now you know that we cannot advertise. When we advertise, we are langgar undang-undang. Okay, the MDA come and take all the first time we get This is the medical item. They ask us take away our internet, all the advertisement, we thought we can help cancer, we can help this and that, okay, and all the brochure, he said throw away. So poster, everything threw away, and our bunting also threw away. We need to redo. No, these words can be put there. Okay, so that's why we need to ask help from you all. We cannot do all this. Huh? Okay, and this is, even though this is a medical machine, at the same time, it can use it at home, and your whole family can use now. In the long run, actually, after I used for 3 years, touch wood, I did not admitted hospital for so long already. Okay, that's why I'm so grateful, because last time every month I need to go to hospital, but paid by my company. So now, touch wood, I don't want to go there. I know that X-ray actually is a positive ion, use up my negative charge. That's why the more I admitted hospital, the more medication I take, and medication also positive ion, the more I got problem in my health. Okay, so any question you want to ask, just ask anything you want to ask. Just now, somebody said 鼻窦炎 I read 鼻窦炎. I tell you, yes, can help. How you do it? No, you put the big plate on here, on the place that got 鼻窦炎, and small here, small one you put here, you tie it. Very effective. Because I got customer, I got my patient got it, and I teach her like that. She said, "Ayo, wonderful! The 鼻窦炎 no more. You don't need to consume anything, just put, because anything grow in the body actually is because of the positive ion. Positive ion 超酸那个水超酸咗。So you see, if let's say you buy whatever, or you buy meat, you put in, you come back, you put in the 超酸嘅水那個肉梗爛㗎嘛。All the meats is what is a cells made okay? Same thing, your body cells, all the cells, okay? 100, how many cells? 60 trillion cells in your body rendang, soak in the 臭酸嘅水唔死唔病哎呦 my goodness, all right? Now you understand. Now you see, if they will soak all the dirty, all your cells soak in the acidic water, okay, you sure get sick one. Then why people that using our device got an amazing result very easy? We use a scientific way, we change the acidic into the normal, neutralized, pH 7.45. Is suitable for your cells to grow, especially cancer cell. This is research done in Japan. Cancer cell like acidic water. So the more chemo you put in, you make your whole body acidic. Then the chemo cell is the DNA chemo cell is like that. They don't have the like our eyes after the cell make eyes, our ears they no more make eyes here and there. This is a DNA in the human body, but cancer cell is they don't have that. Whatever the place is dirty, acidic, more acidic, they like to make a place for them to stay. That's why they grow there. That's why people that after they got, I got one patient after chemo, from the lung in the breast after chemo, go to the lymph nodes, then go to the liver, then go to the lung, go to backbone. Okay. So it's very scary because you need to understand that, and this is a research done. I read the research. I do not earn the right to talk something that just from my imagination. I am not trained to be a doctor or medical people. what I share with you is all the research done by Dr. Noburu Horiguchi, from the research, from the thesis. Then I read that, I transfer my knowledge to you. Then I read one of that, like just now I said that, he said that the cancer cells is just whenever your place is acidic, is dirty, it will go and grow there. Yeah, that's why people that who do a chemo immediately must use our machine to neutralize it. We do not stop people for any treatment. We will not. We don't hold any right to ask people not to do this, not to do that. But what we want to say is, you at the same time, please use our machine intensively, not one, but two, to neutralize the harmfulness, the positive ion that use up your reducing electron in your body that harm others' organ. Now you catch my meaning. I am not good in English, but I hope that I can pass you some very clear message. Okay? So anything? If not, please ask your friend to attend the 3 o'clock Saturday topic, same. This week is English. Thursday English, Saturday English. Okay? So any question? If not, I really appreciate your time. I already used up too much of your time. I really, oh, thank you, Kong. Because you said my English can understand. Okay, okay, okay. Very good. Thank you very much. Okay, I see you Saturday. Please attend. Please attend. Okay, please attend and please invite your friends to attend, because we don't have any record of your friends. Ask your friend. No need to scared that. We will call them. You know, we will do sales. No, we will not, because I believe in God. Everything arranged by the spiritual. If you allow, you just come. So just make appointment with us to check your acidity of your body. There's a fundamental to make yourself look younger, look healthy, and not only look inside you. When inside your cells is okay, is already nice, so you appear, your face is very radiant. The word's called shining. I am very grateful that with my age, me, people that like me, people that trust me, and people got confidence with me, come with me, and we promise ourselves we don't want to die in ICU. Okay, we want to have a natural death on our own bed. So thank you very much. All the best. See you Saturday. Bye-bye.